Good morning, everyone. Welcome to the 10th Annual Empowering Capable Climate Communicators Symposium. This year, we are honored to host it with our partners at the University of Miami's Miller School of Medicine, and it will be focused entirely on the climate crisis and our health. My name is Natalia Ortiz. I am the Director of Development for the Clio Institute, and I will be your host throughout the symposium. I would like to take a moment to remind everyone that this event is being recorded and you will be receiving a link in your email every day. And now, while we don't anticipate any technical difficulties, if we do experience them, please stand by. We do have a technical team on hand. Now, before we get started, we would like to do a land acknowledgement. You will see a link on the chat. Please click it. This is part of our interactive learning experience. And type in your address to learn more about the history of where you stand. If you're visiting from outside of the US, please take this opportunity to investigate one of your favorite US cities. And so we begin. We acknowledge that the Clio Institute is located on the land that is ancestral and traditional territory of the Tequesta, Taino, and Seminole tribe of Florida. We as a whole pay our respects to their elders, past and present, and extend that respect to their children, to the generations that follow, and to all Indigenous people. We recognize that this land remains sacred by the histories and ongoing legacies of settler colonial violence, disposition, and removal. Despite all of this, and with incredible resilience, these Indigenous nations have remained deeply connected to this territory, their communities, and their cultural ways of life. We recognize the ongoing relationships of care that these Indigenous nations maintain with this land and extend our gratefulness to them and hope that as we live and work upon their territory, we do so with humility and respect. May we all learn to live in harmony with nature. Thank you. And while a lot of you attending today already know who the Clio Institute is, there are some of you that do not. Clio's goal is to educate and empower communities to demand climate action, ensuring a safe, just, and healthy environment for all. We offer many educational and advocacy programs, as you'll see in the video I'm going to share with you now.
I want you to ask yourselves those tough questions, the ones we avoid: how we want to live, what do we want for our children, what do we want for our planet?
Our atmosphere is so finely tuned for what we need, and we're treating it like a dumping ground, a sewer. The health impact of climate change is a global problem, and we see the results of that on a local level.
If we fail to act now, then we will leave behind a fundamentally degraded planet for our children and grandchildren, a planet that resembles the futures that have been portrayed in dystopian Hollywood films: unprecedented inundation of our coastlines, droughts, floods, heat waves, superstorms. That's the future that we will see if we fail to act on climate.
The Clio Institute was founded in 2010 with the drive to educate and empower South Floridians to act on climate. Founded by Caroline Lewis, a science teacher by training, her vocation led her to understand what was causing people's apathy towards the glooming climate crisis: knowledge.
We're in the middle of the sixth mass extinction.
Today, the Clio Institute is the #1 nonprofit organization for climate education, engagement, and advocacy. Through programs like the Clio Speakers Network, Clio trains people to become climate speakers by breaking down the science, impacts, and solutions. Clio's educational efforts are backed by a world-class expert advisory council of scientists, environmentalists, teachers, and government officials. While the world is already feeling the impacts of our changing climate, not everyone is feeling it the same way. Clio is a leader in the climate justice movement, providing the resources and tools to the most vulnerable communities in South Florida that are on the front lines of the climate crisis.
I wanted to be an outreach for them.
Building communities' resilience through women is the cornerstone of our Empowering Resilient Women program. By teaming up with community members like the YWCA, Clio is able to empower and educate women on how better to prepare for more extreme weather events like hurricanes while building community. Clio works to remove barriers and build a wider coalition to fight climate change across faith-based communities, elected officials, and municipalities, schools, and cultural organizations. One of the most important voices that Clio continues to amplify is that of our youth.
What do we want? When do we want it?
Their Gen Clio program meets regularly with students across the region, training them to be climate ambassadors in their schools and communities.
Dear elected officials,
this is a crisis. Do your job. We'll be watching.
Clio recently launched its Climate Resilient Schools initiative to bring their program into the classrooms while building a robust climate curriculum for Miami-Dade public schools. Clio continues to expand its engagement through multimedia outreach, including television commercials, social media, and billboards. With statewide campaigns like the Florida Climate Pledge,
I care about climate change, and I care about climate change because it affects everybody regardless of race, culture, and ethnicity. Because I'm passionate about the success of my future.
I like the Clio Institute because it takes the time to educate people about the importance of climate change and the things that we can do to improve our world.
You can have your voice heard too. Fund our climate action work today. The future of Florida is in your hands.
We would like to take a moment now to thank our event sponsors. Without you, we wouldn't be able to do this event. And a special thank you to our premier sponsor, the British Consulate General of Miami. Now, today's a very special day because today is Give Miami Day. It's the nation's largest 24-hour fundraiser, and anyone from around the world can participate. The Clio Institute did lose a major grant due to COVID-19 that helps fund our youth programs in the 4th largest school district in the United States, Miami-Dade County. So we hope that you find it in your hearts today to help us fundraise for the critical work that we do to provide climate literacy to our students and teachers and mobilize them to become climate ambassadors. And so for the rest of today, we're going to start off with our welcoming remarks, followed by our keynote from the American Lung Association, and then our panel on climate and health. At noon, our clinicians will be asked to join the breakout session hosted by the University of Miami's Miller School of Medicine. For everyone else, you will continue with us on our second keynote with Mr. John Rulak from Kiss the Ground, followed by our climate, health, and food breakout sessions. So without further ado, I would like to welcome Yoka Arditi Rocha, the Clio Institute's Executive Director.
Thank you, Natalia. Good morning, everyone. I love that. I love what JC said. Let's get uncomfortable to create big shifts. It is my pleasure to welcome you today to our first ever virtual climate symposium. We have almost 600 people from around the world registered here today. As an organization that focuses on solving the climate crisis and helping those impacted the most, highlighting a deeper understanding of the intersection of a changing climate, public health, and the social and economic inequities that exist in the communities we serve is important to us. The global pandemic has shown us once again that racial injustice, air pollution, and the climate crisis are intricately linked, and that the color of your skin and the zip code where you live can be a death sentence. The depth of the COVID-19 crisis and the scope of the response means that choices being made right now will shape our society for decades to come. Climate change is the greatest public health threat of our time, disrupting large global systems and altering the physical and social landscape of our communities. From respiratory and cardiovascular disease to mental health and infectious diseases, we face an indisputable climate and health emergency. We must do more to lower our global warming pollution. And as policymakers take steps to ensure immediate relief and long-term recovery, they must consider the interrelated crises of wealth inequality, racism, and ecological decline, which were in place long before COVID-19 and now risk being intensified. This is a time to be decisive in saving lives and bold in charting a path to a genuinely healthier and more equitable future through a just recovery. The day after the election, the United States officially left the Paris Climate Agreement. On December 12th, we will be celebrating the Paris Agreement 5th anniversary, where world leaders will recommit to bigger global warming reduction goals to curb rising global temperatures. COVID has allowed governments, businesses, and community leaders the opportunity to accelerate climate action with an equitable recovery program, one that puts us on a sustainable pathway while achieving economic prosperity and environmental justice for the same people that are on the front line of both crises. It is time to act with conviction and determination. The solutions to the crisis is clear. We must transform our extractive economy to a clean, regenerative, and inclusive one. This is usually where the applause comes in. But for that, I'd like to thank you all for joining us. It really fills my heart with joy seeing so many people here today that care about this critical issue. I hope you'll find the program informative, enlightening, engaging, and inspiring that moves you to become a louder voice in this matter. Make sure to follow us on social media at Clio Institute. For the health professionals here today, I'd like to salute you and thank you for your commitment to protecting people's lives, especially those of you on the front lines of this pandemic. I also want to leave you with this, that despite what you hear in the news, you are trusted sources of information and trusted messengers. And we need you. You can help us build leadership on climate and policy solutions while engaging with your patients, peers, community, and policymakers, as I do hope, and I do hope you will join us. To the University of Miami Miller School of Medicine for their incredible partnership and their vision to create a Master of Science in Climate and Health program. And to my team, who have risen above and beyond to put this incredible virtual space for all of us to learn and share. You're an amazing group of talented and passionate people, and I'm grateful to work alongside you. Thank you. And now, without further ado, I would like to introduce you to the University of Miami School of Medicine, Dr. Naresh Kumar, who has been a partnership in putting this great event together and who will have some opening remarks. Dr. Kumar.
Thank you, Yoka. I greatly appreciate it for a wonderful introduction. Let me figure out how to share my screen. I am filling up Dean Ford's space, so he couldn't make it due to an unfortunate event. So I welcome you all on his behalf and Miller School of Medicine. As Yoka was saying, climate health is one of the 21st century crises that we face today. And health and well-being is at the center of this climate crisis. Climate and weather patterns of our planets have been constantly changing throughout the geological history. There has been nothing new. However, in the recent phase of climate change, we humans have pumped in too much anthropogenic gases in the atmosphere and accelerated these changing climate patterns around the world. We are already witnessing the adverse health effects of these changes around the world, such as unintentional injuries due to forest fires and hurricanes, rising microorganisms due to king tides and flooding, increasing allergies and asthma due to prolonged blooming seasons, the constant threat of vector-borne disease outbreak that we witness and face here in Florida, undernutrition due to severe and prolonged droughts around the world. With COVID-19, these impacts are further magnified as we have been witnessing increased frequency of hurricanes in the Gulf. It's already Thanksgiving time approaching when we are still seeing so many named hurricanes. We have seen the most intense dust storm that we witnessed in eastern coast of the United States last summer. So the University of Miami is committed to address these health effects by actively engaging in transdisciplinary research to develop empirical evidence of the health effects of changing climate and weather patterns that can guide policies to mitigate and manage these adverse health impacts. We are engaged in transdisciplinary training to train future generations of clinicians, healthcare professionals, researchers, and leaders. As Yuka was saying, We already have two standing programs at the University of Miami, first of a kind graduate program in the climate and health. It's a graduate program, 2-year graduate program in climate and health. And very recently, we are also starting a new climate and health pathway for our future clinicians. We call it Next Gen MD program, and climate and health is one of the research pathway they will be exposed to. We are committed to engage our communities in mitigating and managing these adverse health effects by engaging our communities, such as delivering healthcare services using mobile clinics. Also provide the leadership role to guide policies to mitigate and manage the adverse health effects of changing climate and weather patterns. We welcome you all in this 3-day symposium and look forward to your constructive feedback and learn from all stakeholders' perspective about the changes and the challenges and the opportunities to address this 21st century threat that the changing climate and weather patterns poses. So welcome to you, all of you.
Thank you, Dr. Kumar. We're very thankful for our partnership. And now it is my great pleasure to introduce you our first keynote for today, Dr. Khatri from the American Lung Association and co-director of the Asthma Center at the Cleveland Clinic. Dr. Khatri.
Yes, I'm on my way here. Good morning, everybody. I'm just going to check in and make sure that people can hear me. Wonderful. So I am so privileged and honored to be part of this program as the keynote speaker. This is an amazing movement that you have at Clio Institute, and to partner with the American Lung Association in such a way. And also, I'm here to also represent the Cleveland Clinic in our work. So thank you again for having me, and just amazing that we are moving forward with conviction and determination, as you suggested. What I have learned is that if I have any disclosure, it's that I care about my patients beyond the bedside. You know, when we see them in the four walls, we listen to what their symptoms are, we get a good history, but do we really think about the areas they live in or the environment they're in? I'm glad to see that University of Miami is starting to make us think about this even more, and the Clio Institute is helping educate us to do better. So I'm thinking about many patients that I have taken care of, but I'd like to just share a few of them with you. I have an 83-year-old patient with asthma. She's a matriarch of her family. She clearly runs the show, even from sitting in her lounge chair. And about 3 years ago, she had had a flare-up of her asthma. And when I listened to her and why she was having this flare-up, she mentioned it was the heat, and also it was the 5th of July. And she had been around fireworks, and the smog from the fireworks and the soot from the fireworks and the humidity combined to give her an asthma flare. And then I think about another patient of mine. She's a young 26-year-old aspiring actress, and she lives in the Cleveland area, and she has significant seasonal allergies and noticed that this is getting worse over time. And of course, in the Midwest, we're experiencing changes in our climate where we go from vortexes to extreme heat, and our allergy season has been extended due to milder and shorter winters. And so she's noticing a worsening of her allergy-related asthma. So what does she do? She moves to LA to try and become an actor. And so what is she doing now? She's hoarded up in an apartment and trying to make sure that the wildfire and the pollution from wildfires is not affecting her as much. And though she's staying indoors, it still affects her even when she's indoors. And then lastly, I was thinking about the red tide. I was thinking about Florida as I was preparing this talk. And about 2-3 years ago, I met a retired school teacher, just wonderful, wonderful lady, originally from Germany. And she went on a special trip with her husband, and she went down to Florida, and she was swimming with the dolphins. and then soon afterwards developed a pneumonia. Actually, what happened is one of the dolphins sort of kicked back some water, and she felt like she inhaled a little bit of water. And she ended up having pneumonia, which was not resolving. And then pneumonitis, so inflammation of her lungs. And all this was probably related to the algal bloom that was going on at the time with red tide. And she looked like she was heading for a lung transplant. That's how severe she got. She was on 6 liters of oxygen and barely holding her oxygen level. But with some biologics, she's gotten a little bit better and she's able to travel a little bit. But clearly, these are 3 very, very real, concrete examples of how we're seeing climate change and health colliding. And if we're not paying attention, we won't notice. We can't predict who's going to be affected, but I will bet you that almost everybody you see in your offices or people you encounter are vulnerable in one way or another. But how do we take something that's nebulous and translate it to something that's understandable? Well, one way is to see it. So one of the things that I did when I was working at our county hospital is we had a wonderful view of the skyline of Cleveland. And what we were able to show with a haze cam, which by the way, there are haze cams that's available on the internet, it's called hazecam.net, where you can see skylines. On the same day on the left side, you see a picture where there's morning soot and smog from traffic, people coming in for work. And then later in the day, it had cleared up. So seeing is believing. So when you show people who don't understand these concepts and say, you know, when it looks like that on the left, don't go running outside and maybe just wait till later in the day, becomes a chance for an educational opportunity. Another way to make this relatable and translatable to people is to evoke emotion. And commercials get me every time. And so having the ALA about a decade ago came up with the Red Carriage campaign, which shows this beautiful red carriage, which evokes ideas of family and maternal love and children growing up and the promise of the future. But what it shows is, as it's sitting in different areas, including an industrial steel yard, and then at the steps of Congress and in the halls of the Senate, all you hear is a little baby coughing. And so can you just imagine what that evokes in people? Like, do something, help me, please, I'm suffering. So when people understand the immediate, like you can see it, and future health impacts of climate change, they're more likely to call for action. So seeing is believing and evoke emotions. That certainly helps. So we have to make this about humanness, not politics. That's our challenge. We are now getting to the point where we realize we can't just count on government or just people or their goodwill. As physicians and clinicians, we're seeing this happening all the time and we need to get involved. I'm so thankful for the Lancet Change in Climate series that they've done yearly to talk about how can we change what the world is doing to help the health of everybody. And it's interesting, they're so sort of clear about it, although in its typical British way, so classic. With both health and the climate crisis engaging such heightened interest, an opportunity exists for health professionals to bring the inextricable links between them into focus. Meanwhile, the American Thoracic Society, Dr. Pinkerton, they had a workshop, and in 2012, they had published the results. They said, the voice of the health professional is essential in forward progression in climate change and health. Because as the Lancet report points out, every child born today will be affected by climate change. How we respond will determine the world we live in tomorrow and will shape the health of children across the globe at every stage of their lives. We have to act now. And what happens if we don't act now? What does climate change mean? It means that with our human-related pollution and some other pollution as well, we end up showing that there's more carbon pollution and it traps heat and it increases global warming. And so if we concentrate on ways where we can reduce the rising temperature, we can potentially and definitely reduce the health effects, because doing nothing. So what we're observing now is already increasing heat. If you look down the left side, if we go with a reasonable scenario of reducing our pollution, we will still see heat, but it'll be definitely less than if we don't do anything, where we'll see such extreme heat that this will become a dystopian world in a certain way, because there are things that will happen that we will never have anticipated. Everyone will be affected by this. As I mentioned, all children will be affected by this, but some people will be disproportionately affected. And how is that fair to them? They're members of this planet just like everyone else. What are the health impacts of climate change? For those of you who are clinicians, you're probably quite aware of this, but those who are not, speaking about health is very important. With longer durations of warm weather, you might have longevity of mosquitoes, increasing malaria, and also ticks with Lyme disease. With longer and more intense pollen seasons I was talking about, when you have a lot of warmth and milder winters, the allergenicity of the pollens increase, the allergen content increases, and then people suffer from more allergies. Of course, we know what hot heat feels like in certain areas. I know you do in Miami and other areas of the world. It's hard to breathe. It's bad for people with chronic conditions. And then, of course, the floods we talked about. And then, of course, the intense wildfires. You know, when Gavin Newsom calls it a tinderbox, that's a perfect representation of what it is. And people suffer for days and weeks and months on end and across the globe from these wildfires. So how do we know that climate change is degrading air quality? Well, people are paying attention. People who are not political, people who are caring about the globe, the earth, and the public health of everybody on this earth are doing their job. And I'm very happy to see that the Clio Institute is doing that, and so is the American Lung Association, because for the last 2 decades, we've been coming out with a state of the air report from the American Lung Association. It's one of our most valued outputs that people look at for truth when it comes to air pollution. There is measurement and accountability in the state of the air report, and people look to it as a source of truth. Politicians who are interested in making change look at it. The media look at it. Health policy individuals look at it. And what is it? It looks at all of the different areas of the country, county by county, counting up how much air pollution there is, and not just looking at the air pollution levels on days that would be counted by the Environmental Protection Agency. They're very stringent about, they want a certain mean of a certain number of days to be falling into this and that category to be counted. Well, the American Lung Association looks at all of the days and all of the levels of air pollution whenever it's been measured, and also takes into other factors where health is concerned, including chronic diseases, number of people with asthma, COPD, heart disease, and also looking at various demographics, age, whether you're a person of color, and other chronic conditions. So this is a very robust view of the link of climate and health together. And it's a very simple way to look at it. You're graded A to F. Guess what? F is not a good score. And unfortunately, in the last 2-3 years, we've seen an increase in the percentage of people living in America who are in F-graded countries. Unbelievable that that's happening. In the state of the air of 2019, we had 9 million fewer people living in these polluted counties. When we compare to the state of the air in 2018, there were 16 million fewer people living in these polluted counties. If you think change doesn't happen quickly, think again. As soon as policies started being rolled back, I can't say that this wasn't part of the issue. So we need to think about this as we move forward and demand accountability from the people who should be protecting us and independently looking at the data ourselves. So our state of the air tells us that there's warmer temperatures, and with warmer temperatures, it's harder to scrub away the ozone. in North America, the ozone season is from May through September. And this is when we see more happening. But of course, these seasons are being extended due to climate change. And of course, we're seeing more frequent and intense wildfires. We don't even need to mention that because it's so visible. And it's ironic to me that somehow something that is so visible can be so easy to be dismissed. But unless we make the health linkages and study this, it always risks being political. And one might think, oh, this is a temporary issue. My eyes get a little irritated, or my nose starts running a little bit, or I feel a little bit of a cough. But the truth is, there's not just short-term, but there's long-term air pollution and health-related effects. There is a wonderful article by Pope and Dockery, and it's called Lines That Connect, and it was published in 2012. And it was a very eye-opening read for me. I was getting into this a little bit more, and that's what sort of really put it together, that how many areas of our bodies are affected by changes in air pollution. I mean, we think about kids being vulnerable and adults also being vulnerable from the standpoint of heart and lungs, and even neurologic changes where you can have strokes from this. So just understanding this is very important. Other compelling data has been that people who live in areas that are less polluted by 10 micrograms per cubic meter of particle pollution are likely to live for 7 months less than people who live in less polluted areas. So many studies are out there that are epidemiologic, and more studies that are being done in a molecular sort of way to prove this to be true. So even though everyone is at risk, and as I mentioned, anybody can be at risk from air pollution related health issues, because it's not always immediately noticeable, people don't believe it. But it's clearly obvious in people with health issues to begin with. So children and babies are very, very vulnerable across the globe. The State of Global Air from the Health Effects Institute in 2019 said that nearly 500,000 infants died in the first month after birth from ambient and household air pollution. 500,000 people with potential, each of them, lost because of air pollution. In Cleveland, I've looked at people who live downstream from a steel mill. They also happen to live in high lead areas. That's where the hotspots for asthma visits for these pediatric patients were. And then when I worked in Atlanta, I looked at people who weren't necessarily symptomatic, but had asthma, and people who didn't have asthma. And even during ozone days that were within the ambient air quality standards, we saw evidence of inflammation and lower lung function. So it happens. This is not them making it up. Their blood's not lying. The inflammatory markers tell the truth. And of course, we're talking about the pandemic now. And one always has to wonder, what is the role of air pollution and COVID? Does that add to the vulnerability of the people most at risk? And as we saw these health disparities become nakedly apparent and so embarrassingly so, how are we addressing where we all live in the ecosystem to help manage that? And this, just thinking of even the wildfires, people are studying this. Of course, there's individual factors too, but we are just beginning to scratch the surface of these associations, because viral illnesses come, but now we're seeing that they're not leaving. They're leaving lasting effects, the long haul syndrome. What's going to happen 2 to 4 years from now? Think about what happened with the World Trade Center. How many people are still affected so many years later? I'm really concerned about the mixture of air pollution and these pandemics. Hope is not lost. Part of my disclosure should have been, I'm a realistic and eternal optimist. The Clean Air Act was enacted the year I was born, so I feel like intricately linked to the Clean Air Act and feel very personal when it's attacked. But the good news is that the Clean Air Act does work. It was 50 years ago that this was a landmark bipartisan mandate. And it has changed so many people's lives. It has saved people's lives, and it's saved money. It's not a zero. It's not one versus the other. And it's allowed for so much innovation from clean energy. And people are ahead. The industry's ahead of the game. But it's funny that our government is lagging behind. So much comes back to messaging. I mean, I can speak among friends here that we are all understanding and very passionate about this. We have to bring others along, speaking to the co-benefits of having a stance on clean air and addressing climate change. With different sources of data, as you can see, that as our aggregate emissions have gone down from 1970 to 2018, that's when the Clean Air Act was initiated in 1970, we've seen CO2 emissions stay relatively steady, of course, can be better. Energy consumption going up, the world is getting bigger. There's an increase in population. People are still driving, people are still going where they need to go, and our GDP is sound. We can do both at the same time. This is not a political issue. It needs to be a co-benefit issue. So I hope I've made the case for you to be interested in this. So what can you do? You may be wondering, what's my first step? Well, engage with Clio Institute, engage with the American Lung Association. Find out a little bit more, even host a film screening. Allow me to please share with you a short trailer of this wonderful documentary that was filmed by the American University and supported by contributions by the American Lung Association. Please see.
Before the Clean Air Act was in place, we literally had cities that you could be in and you could look up and not see the sun.
You saw the cars smelling terrible, and so the pollution was a visceral experience.
We know that long-term, low-level exposure to polluted air is unhealthy.
1969 was the year of the landing on the moon. You had sort of a collective attitude.
Surely we can move confidently now to achieve a better, more peaceful life for our fellow humans.
Action to clean things up may have begun in Washington on this Earth Day.
There are few pieces of legislation that affect everything you do all day, like breathe.
Whenever there were efforts to change, roll back, stop advances, environmental protection, it has been the health issue that has rallied people.
If it's about you, your family, your kids, you will demand that the federal government step up.
It's a human right to breathe clean air, and that right is being violated.
We have implored DuPont to at least reach what EPA says is a safe level. They have refused to do it.
Neighbors near the Clairton Coke Works showing just how frustrated they are.
Who is tracking our health, and what system is in place?
There's a problem in Clairton, but there's a problem all around this area because this pollution travels.
It takes government at the federal and the state level. It takes business and industry throughout the country, and it takes citizens pushing in the right direction.
We are engaging with more and more Gen Zers. I have 4 Gen Zers at home who take this as an obvious thing that we need to be involved in. We can do this. We can do this. And how? Small steps lead to big changes. It's just one step at a time. I urge you, I encourage you to sign the pledge to stand up for clean air. You can find out how you can live in a more clean way, how you can avoid adding to the footprint, the carbon footprint. Taking these critical actions at key points and knowing when to speak up is critical. For the health professionals in the audience, you can certainly sign up to be a change agent in your area. Again, we are not supposed to be practicing within our small four walls. We need to practice globally. You can sign up for monthly newsletters. You can write letters to your people, to your policymakers in Congress. You can share why it's important to you so people hear from you and your perspective. Very important. So engaging in being part of a coalition. And then if you have the interest or the wherewithal, go get active. Tell the stories. If you got nothing else from this presentation, I hope you got the importance of stories. Because you know what? I've done testifying for EPA with the scientific committee. And it's funny because there's several people for public comment and then so-and-so lobbyists from one side, so-and-so lobbyists for another side. And you're just sitting there listening and people who are epidemiologists get questioned. And then I get up and speak and it's crickets. I'm like, I'm ready for battle. I'm ready with all the evidence. They're like, people don't refute physicians and clinicians because, you know, why would you lie? You're trusted. We need to be out there, out front, making change. I hope this was a call to action for you and a motivator to keep calling out for action in the future. I appreciate your time and I'm so excited to be here. Back to you, Natalia. So I have some polling questions that are here for you. If you don't mind, please answer these questions and then we can certainly provide more information that's related to those areas of interest for you. Thank you again.
Thank you, Dr. Khatri. So please take a moment to answer the poll questions for Dr. Khatri. And while we answer those poll questions, I would like to share my screen. Dr. Khatri, we do have, if I share screen, will the poll questions be removed? I'm not sure. Okay. Dr. Khatri, we do have one. Oh, there they still are. We do have one question.
Oh, sure.
That comes from our young Gen Cleo kids from the School of Miami Palmetto Senior High School. Should air pollution regulation take place in the federal or state level governments?
Both. So I believe that there has to be a unified federal law because you can see how effective it was when it was enforced and utilized and how much change we've been able to make. Also because there's cross-state air pollution. So Ohio is affected by Indiana, Pennsylvania is affected by Ohio. If we just do it state by state, there will be no accountability to our neighbors across the nation and across the world. But also there's benefit to some, if you were to want more stringent regulations in the state, that should be allowable. For instance, California has been an area of innovation because it's been ahead of its time, ahead of the US's time when it comes to clean air policy, and they need it for sure. But that's where innovation comes in. So I would encourage both, but the national one should allow for more stringent ones locally on the state level. Thank you for your question.
Thank you, Dr. Khatri. And so now, as part of our interactive learning process, we are dropping the State of the Air report link below. Please take a moment to click that link, type in your zip code or city, and learn what grade you have in your city. If you live outside of the US, please visit one of your favorite US cities to learn. For the Clio Institute and the University of Miami's Miller School of Medicine, we're based in Miami-Dade County. And unfortunately, our grade for ground level ozone pollution is a D. I'm going to give you a moment to see what your grade result is, because I'm going to ask you in a minute to use the power of your social media. So for those of you that have Twitter, you can also use this on Facebook or Instagram. We're dropping the link with the language so that you can share the report of the American Lung Association and input your grade. Please don't forget to use the hashtag ECCC 2020. And now I would like to welcome our first panel with our moderator, Dr. Cheryl Holder. Dr. Holder advocates for comprehensive medical prevention and care strategies for vulnerable communities impacted by the climate crisis. Please note, questions will be taken at the end of the panel. Please use the Q&A function for this purpose. Welcome, Dr. Holder.
Good morning, thank you. Our panel today is really excellent, and I look forward to hearing all our participants. We will hear from Dr. Sumita Khatri, who you just heard that wonderful presentation, who is a professor in medicine from Cleveland Clinic. Also, Dr. Michael Campos, who is a pulmonary specialist at the University of Miami and the Miami Veterans. And we'll also hear from Dr. Olivine Carrasquillo, an internist from University of Miami. And our final speaker will be Dr. Asim Jani. Sorry about that, Dr. Asim Jani. He's a clinical educator and infectious disease specialist and associate professor at Florida State University College of Medicine. And we will start and hearing each of the presenters will give us a little idea, a short presentation on the topic, and then we'll follow up with a 15-minute questions, and then we'll take questions from the audience. As you listen in, please get your questions ready so we can hear from our speakers. So let's start with Dr. Khatri.
I'm here.
Yes. If you wanted to follow up on more of what your presentation and what we want to continue about climate and health, in specific, what are some of our big areas that we are going to have to deal with? You gave a very big overview, but now 21st century, our audience, if you had to choose, what do you see out there for us?
Reducing our carbon footprint, and that will include including the particulate matter that we generate. When I was, when the Clean Air Act was established, we were going to the moon, and now we're also again going to a space, space station. And we have people like Elon Musk and other people who are actually believing in the idea of improving our carbon footprint. So we need to encourage this kind of innovation and really even, hopefully with this next administration, reduce our reliance on fossil fuels, because this is a very limited entity. So I think though it's comprehensive, if we can think about our carbon footprint and reenact the Clean Power Plan, it'll motivate change and will reduce the soot and the global warming and the particle pollution and weather changes as well.
So you're definitely getting at the root cause, yes, which is, as physicians, we're taught, go for the root cause, and you will have a bigger impact.
Right.
I know some of our other panelists, they had a presentation and a way of, and Dr. Asim Jani has an idea and a way of reframing this issue and looking at how we can think about this whole climate and health. Dr. Jani? No? Did I miss Dr. Jani?
Oh, hello.
Stand by, he's entering.
Oh,
Can you hear me? Hey, how are you?
Hi, great seeing you today. And your presentation, which I know you've prepared, we talk about reducing carbon footprints, and you give us a different frame. So I would love to hear your understanding and following up on what Dr. Khatri was referring to.
Certainly. Well, I allude to this in the presentation, and so perhaps maybe even become a little clearer.
Yeah, great. You can share your screen.
Okay. Mm-hmm. And Dr. Holder, should I present my material because I was listed 3 or
Sorry, I may have messed up the order because I'm looking at my phone here with the orders. So sure. I've been going changing a little bit based on the comment. And okay. I think your presentation will be great right here because it follows up on the carbon footprint.
Sure. Thank you so much. So hopefully you should be able to see my screen.
Yeah, it's great.
Okay. So, certainly I think that the comments that Dr. Khatri made and and you know, really all of you. Whoops, not sure what's going on there. 1 second. So commenting on the you know, the issues at hand, this is indeed one of the main takeaways from my talk, or this discussion, is that really when we think about our problems in medicine and in clinical health, clinical medicine, public health, we tend to be linear. We tend to think of things in terms of a cause and an effect. And I think that COVID-19 and some of the emerging infections will really they sort of emphasize the fact that we really need to think of all of these things in systems. So with that said, really, I have no disclosures except that my slides will have the references for people to go with, and you know, happy to share those as well. So the particular recent event that I was very happy to attend, and it really spoke to the systems thinking approach that we need to all take, was Countdown. And I hope that many of you were able to view this. This was on 10/10/20, and it was archived on YouTube. So I would just encourage all of you to look at it. It was several hours in length. And one of the speakers on that day was Pope Francis. And for many years now, you know, he has made it a priority to speak to climate change and our collective responsibilities for action. And his famous quote here in the encyclical Laudato Si is that we're not faced with two separate crises, one environmental and the other social, but that we really have one complex crisis, which is both social and environmental. So, you know, kind of on that note, this cartoon is something I recently came upon, and I think it speaks volumes. At a time of unprecedented cases, infections and hospitalizations, and of course deaths in the US, you know, it's really hard to fathom that this tragedy is subsumed by crises that even have a larger scope and an impact on societal well-being, such as, for example, the recession and climate change. But it's true. And in fact, this notable environmentalist, James Holland Jones, has stated that we've done a lot to engineer a world where emerging infectious diseases are both more likely and, in fact, more likely to be consequential, just as we've engineered a world where wildfires and floods and droughts and other local consequences of climate change are more likely and more consequential. And I would say that to me, as an infectious disease physician, you know, COVID-19 and climate change are sort of simultaneously hardwired in some ways, but also fortunately preventable in more ways. And recently, even the editors of the New England Journal stated that the lack of US leadership in COVID-19 has in many ways turned a crisis into a tragedy. And the key lesson really from that editorial is that we're all called upon to be more effective leaders in our own ways, especially for climate change. This is an Ipsos survey that rates the top 5 global concerns. And as you can see, each of these really represent complex systems challenges. Indeed, many of these are interrelated and often with common root causes. And they, I think, require us to take very fresh approaches, including questioning our assumptions and considering what the Climate Interactive folks have said, multi-solving. Approaches that inspire us to be more effective as connectors and systems thinkers and creative reframers. This is a busy graphic, but I want to just mention that what it tries to do is to depict the likely impact of climate change on social impact and climate change on social impact and livelihood and human society and enforced infectious diseases. And at the level of social impact, there are these primary and secondary and tertiary effects that relate to the basic needs and well-being of people that can cause further shifts in the population that are of a demographic nature or related to production. And these, of course, circle back to human society. But climate change related natural disasters and several of the issues related to even air quality and damage from hurricanes and other events, these all affect, of course, our human health and human society in functioning and integrity. But then I would say that there's also this very important link between climate change and human infectious diseases that affect human hosts and pathogens, and that really result in a number of varieties of infections. And in fact, you can argue that what we already know, that there are a number of environmental disruptions such as deforestation, intensified agriculture and livestock production, and illegal and poorly regulated wildlife trade that result in the emergence of infectious diseases, 60% of which are really zoonotic, coming from animals to humans. And SARS-CoV-2, the etiology of COVID-19 disease, is yet another recent and deadly example of such a pathogen, which has of course led to rapid human-to-human spread. And if one didn't need any more examples, here's a busy slide, but just to pay attention to the list in the middle, you see that there is a range of bacteria, viruses, and parasites that can emerge directly or indirectly from the kinds of environmental changes that we're, of course, noting. And one particular organism comes to mind that it's worth mentioning. Recently, having left the role of a hospital epidemiologist in a large health system for about 5 years, I saw a lot of this, and this particular pathogen was notable. Candida auris is a multi-drug resistant fungal pathogen that emerged simultaneously on different continents, but spread into the healthcare environment. And the events that are labeled 1 through 5 in this drawing really refer to sort of this logical flow of events that are very likely. Increases in ambient temperatures from global warming likely contributed to this organism gaining tolerance to both temperature and salt. These fungal species can be transplanted by birds and other routes across other vectors across the globe, especially to rural habitats. And then activities that we know, such as farming, can facilitate the opportunity for interspecies transmission to occur. Ultimately, these kinds of things can spill over into urban environments and be introduced into healthcare facilities. So I think that, as emphasized by the experts at Climate Interactive, climate change plus systems thinking can be thought of as yielding system change. And I think that it's an equation worth considering, perhaps not as paradigm shifting as E equals MC squared, but not too far off. And a few years ago, Stephen Peake's TED Talk articulated this concept of system change. His suggestions, while potentially debatable, would form a sort of mini action framework to make a difference. The core concept for us is to individually and collaboratively work on solutions that have the greatest returns in terms of changing the system itself. So, for example, we can consider the value of stopping wasting energy resources, or to change our relationship with carbon and go more renewable, to make public transportation free and preferably electrified, to be more mindful consumers, focusing us on essentials, or to be more mindful in what we eat, or to be more active, engaged citizens. And in fact, this environmental activist, Paul Hawken, published this now famous book, Drawdown, years ago. It's considered a comprehensive plan to reverse global warming and a pivotal text on climate solutions. And in fact, it draws on, as they say, humanity's collective wisdom about the practices and technology that can begin to reverse the buildup of atmospheric CO2, hopefully by mid-century. And this is just a 20 of the top 20 of the 100 items that he's mentioned, most impactful interventions in terms of the number of gigatons of CO2 equivalent reduced or sequestered over the next 30 years. And you can see that these are stratified by actually 1.5 degree centigrade goals that we would hopefully like to achieve by 2100. The Vietnamese Buddhist monk said that mindful consumption is the way to heal ourselves and to heal the world. And with even a modest amount of introspection and squarely looking at our priorities and desires, I think we can agree that we can all do better. For example, we can follow Greta's example when she reminded us of the true cost of flying. One round trip flight between New York and California, and we've generated about 20% of the greenhouse gases that our car emits over an entire year. While governments need to make big changes, individuals can play a big role too in modifying aspects of their lifestyle. For example, considering transitioning to more vegan foods can help. One notable statistic is that the meat industry generates nearly 1/5 of human-made greenhouse gas emissions that contribute to climate change. And ultimately, when we think of problems such as climate change and pandemics as intrinsically systemic and political, it's good for us to recall the etymology of the word politics, which comes from politis, which is Greek for citizen. And it's likely, really literally true in many ways that all politics are local, involving the active and informed participation of the individual citizen to engage local and state leaders, educate them as needed, protest when called upon, and finally hold them accountable for promises and values that they have kept or that they have bestowed. And in fact, C40 initiative in the US and the Global Covenant of Mayors are just two examples of local initiatives with huge impact. So really, as I sort of wrap up, I would say that to learn more about the climate crisis and what you can do to help solve it, please consider seeing this film, An Inconvenient Sequel, Truth to Power, or reading the book of the same name. And really, as was mentioned earlier, get out there, be a change agent, protest like your world depends on it, because in fact, your world and our world does depend on it. I have listed here briefly lots of great resources, and thank you, Dr. Holder, for bringing attention to the book, All We Can Save as well. And these are some books from my library, and I would encourage everyone to read more and learn more. So again, thank you very, very much for this time, and happy to entertain any questions after the other speakers are done.
Well, thank you very much. As Dr. Khatri started off decreasing CO2, we see how context matters and looking at systems change and seeing how we're all interconnected and steps that we can take to fight the basic health issues. And with that, Dr. Michael Campos from the University of Miami Pulmonary Medicine will give us some more information and present on the health impacts.
Thank you very much for the introduction. I was asked to comment about, from what I see as a pulmonologist, what is the impact of climate change on lung health? Because I've been learning a lot from all these presentations, what to do, what action to take. What I can contribute is for people listening is a little bit more information on what lungs are doing to us now, as a mean for you to know and have more power when you address communities, and also to think about more ideas, how can we help our fellow humans that are being affected by this. Can you see my screen?
Yes, that's great, thank you.
So this is a slide I took from the CDC website, which I think that all of you should share when you're talking about this. And I think it summarizes very well from the root of the problem to all the consequences of this what this can bring. You heard about the infectious part from Dr. Jani. You heard about asthma from Dr. Khatri. Of course, there's a lot of social problems that will come with this. And in the respiratory area, most of the talks or papers focus on allergies and asthma, which is a big problem because we will have more pollen-generated sources and mold and things that can lead to allergies. But also the pollutants itself are going to be important in lung health. as you know, we do have an increase in different pollutants that are human generated, but also, ozone is being formed in the atmosphere. Now, ozone is a particularly problematic substance because naturally it's formed in the atmosphere and it's protective. It protects us against UV light. But ozone now can be also formed at the ground level from emissions from our machines. And that in combination with UV light creates a level of ozone at our level, at the human level, next to the Earth, which is directly affecting us. So when it's close to us, it's dangerous. When it's up there, it's protective. So that's another problem that we are facing. I got this model from a paper from a few years ago that illustrates very well. It was made for Europe, but applies to the entire world really, about all these changes that will happen with climate change, with more rain and temperature changes and humidity. How will that's going to affect our physical world, our biological world, chemically and biologically? And what's going to happen to us as humans? It's going to stress our bodies in different ways. We're going to be exposed to these allergens. We're going to be exposed to organisms, to dust mites. We're going to be exposed to ground level ozone, the heat, extreme colds, and the particles. And all this will lead to comorbidities in our lung system. As an example, and I'm going to focus about a disease called COPD. COPD is affecting 25 million Americans right now. And when I used to give these talks, it was the 4th leading cause of death in the US. Now it's the 3rd. And the mortality continues to increase. In most of people's heads, COPD is a disease from smoking. And smoking is a way of having your local pollution straight to your lungs. But nowadays, 30% of cases of COPD are not from smoking. We see a lot of people in clinic that were never exposed to cigarette smoke, and they do have COPD. And one of the biggest is exposure to pollutants. Now, part of the disease is to have what we call COPD exacerbations or flares, where the symptoms get acutely worse, people go to the emergency room, they have to be admitted, it carries some mortality. And you can see here in this study, as in this particular city, in 1 year time, they plotted 3 big peaks of COPD admissions or ER visits. And down here is the calendar year. And at the same time, they mapped the exposures to different pollutants, including ozone, carbon monoxide, and the particles. And as you can see, they follow kind of the same 3 peaks. So every time there is a pollution surge in a specific city, we will have more of these exacerbations. And why is this important? This is a graph that I always show to our students because this is what happens when our lungs are exposed to pollution. This is a particular study with cigarette smoke, but take it as an example of any pollutant. This is our age, our life, from age 10 all the way to 80. Your best lung function will happen around age 20. After that, we all decline, maybe because we age, but also because the world is polluted. The straight dark line is people that never smoke. This is how we lose lung function over our lives. The dashed line at the bottom is people that start smoking early and they keep smoking. So obviously they do have lower lung function. But the other lines, this is when the person stops smoking at age 40 or between the ages 30 and 40 or before the age of 30, indicating clearly that the sooner we decrease our exposure, we save lung. And if we're gonna be living in a polluted world, this is gonna be exactly the same curve what's gonna happen. The sooner we clean the air, the sooner we will save lung function to all of us. The exacerbations that I mentioned will make the lung function decline faster. This is lung function over time, the same graph I show you, and each of these arrows is when people have these flares and lung function rapidly declines faster and faster for people that are lung affected. When people have these flares, chronic bronchitis made acute, or people have flares, these exacerbations will lead to increased mortality. And here the green line is people that have 3 or 4 of these events a year, they will die sooner compared with people that didn't have it. And as I mentioned, this will not only cause death, but it will cause poor quality of life, more shortness of breath, etc., which is deleterious. Each of these exacerbations will increase the cost for society when we treat them in a hospital 20 times compared with people that don't have exacerbations. So it imposes a big burden to the patient, a big burden to society when we look at dollars. And this is from a publication we had a few years ago trying to advocate for climate change, showing that all these changes, as Dr. Jani clearly expressed, will cause ecosystem dysfunction and an impact in human health that is, here we divide it in respiratory and not respiratory because this was for a respiratory journal, but includes these exacerbations and asthma exacerbations as well. And just to finalize the point, what happens with extreme weather? This is a map of how the dust storms happen in our planet. They have a pattern. And here's particular in the US, and particularly in Florida, we get the dust storms that come from the north part of Africa. And as you heard, Dr. Kumar mentioned that this year we had one of the worst recorded. So with Dr. Kumar, recently we published this study. What happens with these dust storms in our patients in Miami? What happens to their exacerbations? And this is data from 2014 to 2016. And as you can see, as years go by, we have more and more of these events and more particles in our air as a reflection of climate change. And what happens to our COPD patients? Because we mapped who had an exacerbation, who didn't have, how much dust were they exposed just before the exacerbation. And we came with a model that in summary, exposure to a dust storm increases, depending on the model you look, the risk of exacerbation more than 15 times, the risk to have 2 or 3 more of these events. So many of us are seeing these patients in the emergency room. We think, oh, maybe you had a virus, maybe you had an infection, but no, it was the exposure to this extreme weather that most of us have had unnoticed. Personally, I didn't know about it until we did the study. So just to wrap up, this is what health can do to our lungs. It will increase the prevalence of these respiratory disorders. It will exacerbate people with chronic disease, which affects 10% of our population. It leads to premature mortality to all these people. It will increase our allergies, and it will cause all of us to have declines in lung function. So I'll be happy to discuss further.
Thank you very much, Dr. Campos. That was a great summary on showing the impact on our lungs. So if we start with decreasing our carbon footprint, we have seen that we do need an approach that requires a change in how we think. And then so we can impact our health, especially in our lungs, in decreasing our pollutants in the CO2 and the ozone. So thank you. And then we're going to follow up now with Dr. Olvin Carrasquillo to learn some more about the health.
Thank you. Thank you. No, I'm not unmuted. Good. Okay. Let me go ahead. As you heard, I'm Olvin Carrasquillo. I'm the Chief of General Internal Medicine here at the University of Miami. And I've been asked to comment for a couple of minutes about, climate health and health disparities, which is my area of research, and how these overlap. So let me just get my slide set up and running. Let me share my screen. All right. Can you all see it now?
Not yet.
Okay, share. I did not press share.
Right. Okay, we got it. Thank you.
All right, good. Let me go ahead and put it on presentation mode. And let me just do, okay. Sorry, I was just reviewing them. Sorry, these are all the beautiful pictures I'm about to show you, and my apologies again. So the work I do is mostly focused on health disparities, as you heard, which is really intersects very much with the whole impact of global warming and climate change, which we're overseeing. This is some of the stuff I do, right? The kind of work I research. This is life expectancy at birth comparing whites versus blacks. And what you will see is here, if you see blacks versus whites, you will see a major gap in life expectancy, and it's even worse among black males in terms of life expectancy. Some of the health disparities, this is data on diabetes, basically showing that both blacks and Hispanics have much higher rates of diabetes than non-Hispanic whites. And this is one slide up on infant mortality, and sorry, this is one slide on infant mortality. Again, showing non-Hispanic black infant mortality versus white infant mortality. And so you see major gaps, and I think my slideshow is going crazy, sorry. You see major gaps in infant mortality there among blacks. I say it a lot, but this is one article that came out of the newspaper, goes back to telling the story that was much more impactful in terms of these kind of stories when you think about health disparities. It talked about babies born a few miles from each other and the life expectancy, and that somebody born in this part of Miami here, the life expectancy versus somebody born in Overtown, 15 years, basically living a couple of miles away. You know, these are the stories when we think about climate change, we really need to consider ways to make it really impactful rather than a lot of these slides and scientific data that I show. So what causes these disparities? You know, we've long known about something called the social determinants of health. When we look at them, which encompasses a lot of things, and this is just some of them, what you will see is that many of these are also some of the drivers that drive a lot of the issues around global warming and who gets impacted by global warming. And some of these, you know, we can go into detail, but as you can imagine, that actually impact on health, education and income, unsafe housing, ability to be able to do exercise, how close you live to highways, you know, whether you rely on public transit or not, and obviously segregation. So those are some of the key drivers when we think about health disparities in terms of, you know, what causes them. So how does that relate to global health? Oh, sorry, and this is from coronavirus. Again, just showing again the same kind of disparities where Blacks and Latinos are much higher rates of coronavirus, not only of getting the disease, but also hospitalizations and deaths also disproportionately higher among minorities. Now we know COVID follows the same pattern as all the other health disparities, which I talk about, and takes a disproportionate toll on minorities. And like everything else, they're rooted in the same social determinants that we talk about. You know, minorities suffer disproportionately from diseases that make you higher risk, access to quality healthcare, but the fact that we're essential workers, immigration issues, segregation, and higher levels of chronic stress, which as some of you will see are, you know are some of the drivers of the climate and global health disparities. So when you look at global warming, again, I see the same patterns of health disparities that you see with every other condition. African Americans are more likely to live in neighborhoods with fewer trees and more heat-trapping pavement. Latino are much more likely to live in counties with poor air quality. As you heard with the pulmonary things, but Latino children are twice as likely to die from asthma. When you look at Asian and Pacific Islanders, you will see who are the ones that are going to be most affected by sea level rise compared to global averages. This is one slide on heat-related deaths, but actually the highest group is Native Americans, but also Blacks have higher rates of heat-related deaths compared to non-Hispanic whites. So again, it follows the same disparities on it. One that Cheryl brought to my attention was extreme heat and maternal health. Now there's increasing evidence that pregnant women's exposure to increased heat also increases the risk of being hospitalized and also affects newborn illnesses. And as always, it's Black women, minority women that are being disproportionately impacted by this. And it's going to get worse over the next century, which is going to further not only maternal health, but disparities in maternal health between Blacks and whites. So there is a clear intersection between global health and do this. Another interesting study I just saw about carbon dioxide induced nutritional deficiencies. Guess who's going to be most impacted by this? The countries in Africa, Southeast Asia. Again, follows the same patterns. We see disparities where we see the people that are going to be most disproportionately affected are the minority communities and also the countries with the least resources. And then, of course, there's global hurricanes. You guys know this data, but there's clear evidence now linking global warming to both increased rainfall, but also severity of the hurricanes as well, and sea level rises. And so here is my, being Puerto Rican, I do have to talk. We've had evidence of other devastating hurricanes, but here was Hurricane Maria that hit Puerto Rico a couple of years ago. Obviously caused widespread damage throughout the entire island. And then we saw that the death toll from the hurricane was not only traumatic injuries, which are relatively few, a couple of hundred, but that's still a lot for a relatively small island. But actually most of the deaths were due to limited access to care, dialysis, people not being able to access dialysis, the people with diabetes not being able to get the refills on insulin. But then we also other consequences, mental health consequences, dramatic rise in mental health illness after the hurricane, and even respiratory diseases, the mold in the tarps that was left over and caused a sharp increase in respiratory illnesses several months later. So all these things interact, I think, between global warming and health disparities. You know, we saw massive disruption in the healthcare system. After the hurricane, no primary prevention services. Most of the procedures had to be delayed. Dialysis, pharmacy, as I talked about. And, you know, even the public health surveillance systems, we had massive outbreaks of leptospirosis afterwards that were never confirmed because we didn't have the epidemiologists to be able to track this, for example. And then, of course, you know, disparities in policies. You know, here, obviously, with the whole Make America Great Again campaign, the address was to throw out paper towels. Relief funds, you saw, oh, we paid 90 billion. It was only about 10 billion that was actually even doled out to the island, which is very different from the Panhandle. FEMA saying the island needs to become more self-sufficient and not dependent on the United States, as if Puerto Rico was not part of the United States, which was very different when the hurricanes hit the Florida Panhandle. Obviously, immediately the Fed stepped in to help. They were even threatening to hold the help if it actually Puerto Rico benefited from that help. So you see all this, and then you see disaster capitalism coming in with a lot of these global warming events. You know, we all saw about the Whitefish Energy, a company that basically had 2 employees getting a $300 million contract, but lots of examples of profiteering that happened from the hurricane. Really, really sad. And, you know, the island's financial issues, we see a lot of the hedge funds that benefit a lot of academic institutions doing extremely nicely, profiteering from a lot of these island-caused financial disasters, many of which were driven by a lot of this, you know, global warming events, as well as many other reasons. So when I look at it in terms of climate change and health inequities, the root causes and upstream drivers, a lot of stuff is based on policies and how we treat different populations, different parts of the country, different groups very differently. And these health risks are not fairly distributed. And so climate change, from my perspective, exacerbates a lot of the existing health and social inequities that are caused by these upstream systemic causes. And we need to build political and economic power, just like for climate resilience, to address health disparities, because at the end of the day, they're driven by the same nefarious forces. This is for the American Journal of Public Health on how to address climate change and health equity. But basically, at the end of the day, the social structural inequalities combined with the policies and systems lead to both the things that result in health inequities, but also the climate health inequities. And so this is really what we need to address when we're talking both about global warming and about health inequities. So my piece is basically, we need to look at climate change through an equity lens. It's the same pattern as most other health conditions. They're rooted in policy things and social determinants of health. Personally, as doctors, we do have an obligation to prepare patients for things that can cause insults to health. And this definitely includes global warming, but we also need to be part of advocacy efforts. Because at the end of the day, it's one policy agenda that's driving a lot of this, and we need to protect our communities from this. And with that, I think I will yield my 10 minutes, but basically, hope I made the point clear of how they're really intertwined, both the issues.
Well, thank you very much. That was a great summary and bringing us back to the inequities that we're experiencing now with coronavirus, but will be exacerbated and brought again to climate. So with that, we've heard all our presentations, and we now have to start bringing it back again with Dr. Khatri. And for all of us to, where do we go from here? We've just heard incredible presentations on the health impacts. We've heard all our challenges. We've heard what our goals are. which is ultimately is decreasing the carbon footprint, decreasing our CO2 and all the greenhouse gases. And we've heard a system possible model of how we address it. But Dr. Khatri, where do we go from here?
One small step at a time. And working where you have a group of people who can amplify your efforts. I'll tell you, when I think about what can I do, it can be very overwhelming. So I have one-on-ones, I engage in larger organizations, and then I'm on nonprofit boards. So working with an organization like Clio Institute or American Lung Association, so whatever little impact you're able to provide has an amplified impact. And then just keep it top of mind. I mean, you can get fatigued thinking about it, but as you watch the news, as you read the newspaper, just keep reminding yourself, what am I doing that's contributing to a positive change?
Okay, what am I doing? Dr. Johnny, where do we go? Oh, unmute.
Sorry about that. Yeah, I think I would echo that what we've learned today really should inspire us to sort of move forward. And I think that while I completely resonate with the idea of taking the small steps that we individually can, I think correlated to that is the idea that we join as many unifying efforts as we can. So one of the things that, for example, I was able to do a few years ago was to participate in the Climate Reality Project training. And I found it to be an amazing experience. You know, I went to LA and really sort of surrounded myself with many, many people who were of a different mindset. And I think this is just one example, as for example, a healthcare provider can try to influence physician learners, other healthcare professionals who are in training, give examples of how they can potentially be leaders, whether it's giving media interviews or writing op-eds or giving presentations. Certainly, I think that there's a level of community engagement that is evident. I think that this last for several years, and certainly the election concurrently with the pandemic has probably brought to the surface so many people who understand what real democracy and patriotism looks like. And I think that being part of a healthy political process is a big thing. I think it also involves educating ourselves and then educating our leaders, whether they be at our institutions or beyond in the community. And I think facing our own insecurities and facing our fears is a big part of it. I always tell people that, you know, that if we can get all people involved in society, but especially physicians and healthcare professionals, to sort of become like zoom lens cameras that can zoom in on the individual patient, but also zoom out, right? And become more population health oriented, then automatically, if you go back to our roots of why we went into healthcare, all that stuff comes up. So idealism, social medicine, social justice, learning from historical figures within and outside of medicine. All of these things we can reinfuse inspiration to the next generation. So a lot of things we can do.
Thank you. Dr. Campos, you want to follow up too?
Yeah, you know, I've been thinking everything I heard now. And it's clear that we do have two layers of action. One is us, everybody listening to this, advocating, teaching, telling other people, going to the leaders, voting. That's one layer, you know. We like to say things and propagate the idea. But we need to emphasize what can we do individually. And all of us should have an action list. This is what we're gonna do on our everyday. And that is what we need to communicate to the general population. You know, you can make a huge list of don't ever use a plastic bag again, or I don't know, something that people will stick to it and apply every day. At the same time, they're advocating this, but we need to guide people how to change their lifestyle, you know, because a lot of people can be in agreement and talk about this, but then they close the computer and they, do something that probably they could do better. So we need to be educating the population, I think, at those two levels, the policymakers and the individual. But otherwise, I don't see the big impact if we don't start here at home, each one of us. And my other thought was, and nobody has touched this, and I don't know if I'm going to be politically incorrect or religiously incorrect, but we are too many people in this planet. And that has been driving the global warming, because now everybody has a car and all that. That's industrial progress, and that's okay. But one thing is to have 100 cars or 2 million cars out there. So we need, for the future of our humankind, we need to slow down our growth, because the more we are, the bigger the cities, the more we consume, the more energy we waste, the more machines we have. And nobody addresses that. We heard about all the things we can do in the short term, in a way, but this is something that needs to be planned for the next 100 years. If we don't slow down our growth, this is going to be a disaster as a planet. Those are my thoughts for now.
Wow, definitely a topic that we didn't expect, but we are going to explore it more because we have questions. But you are correct about our responsibility educating. And in so many ways, all our panelists are saying similar things in just a little differently, except for the number of people. So we're going to put that up for our audience to think about and comment on, and let's see what other people think. But also in the audience, I'm getting questions. And one of the questions is that, are we quantifying the number of resulting illnesses and disease caused by air and ozone pollution? And what kind of strain are we having on the healthcare system? So, and sort of the economics around all of this.
Well, I can take a stab at this. There's probably many ways to collect the data. I mean, the State of the Air report is one way. The Asthma Allergy Foundation of America also compiles reports on asthma capitals, where they look at health care availability as well as disease. But and the Health Effects Institute also has reports that we can look at. So looking at reports over time and comparing how we're doing is important. And we have not really talked about prevention of conditions as well. We're talking about the environment, but also we've had conversations with our patients about their own healthy living, so they're less susceptible. But we have to have a planet where it's easier to exercise and there's food security, et cetera. So I think thinking system-wise from what environment people live in from a nutrition, exercise standpoint, and preventive care, because we are behind in preventive care here in America. And I'd also just like to add on, I'd like to see more public transportation, frankly. I mean, we are so sprawling. I know public works was good for those highways, but part of our carbon footprint reduction can be public transportation. It's cool to share a ride. It's cool to be on a train. We need to do those things more. We need to innovate there. So those are my thoughts.
Okay. Anyone else wanted to comment on how we're quantifying illnesses or transportation or on our population? So many billions on this planet.
Can I add something on this?
Yeah.
Yes, as a matter of fact, a major challenge that we face in quantifying the disease burden related to climate and the environmental conditions that are mediated by climate is very difficult. But nonetheless, many researchers are engaged. And one of the things that you heard from Dr. Campos is the dust outbreak, which is intensified during this year and for the past many years. We quantify how many more COPD exacerbation took place shared because of this dust event. So per se, you can say dust, of course, is an environmental condition, but now it is being intensified. So there we are documenting how many more COPD exacerbation, how many more patients are coming to our clinic. And related to that, we then try to calculate in terms of dollar amount, how much more dollar we are spending. So there are some initiatives in place to do these kind of research, but nonetheless, we still are scratching the surface in quantifying the dollar amount that we are losing in terms of the disease burden that we face due to changing climate and extreme weather patterns.
So still a lot of work to be done.
You know, the one point I think that goes back to, you know, what do we do more than this? We do have lots of data on, you know, how hospitalizations, you know, correlating air pollution levels with increased hospitalization, increased respiratory deaths. There's been a ton of stuff. I think the biggest challenge we do face is just the public, you know, movement away from science, data, and facts. You know, that was again seen in the COVID epidemic. I mean, something as basic as wearing a mask that suddenly became political, and people were speaking from their gut without any data that masks were ineffective. We've seen tons of misinformation around COVID and people just saying, I don't care what the data and the numbers is. This is what I believe because this is what this party says, and this is what I'm going to do. You know, we have a major disinformation, miscommunication campaign, and it's very nefarious. I mean, in global warming, climate change, we've seen that for the last 15, 20 years, just denying the evidence. But now, instead of, you know, moving forward, we've taken major steps backwards. So I think until we address, you know, really collaborated, nefarious efforts to, you know, push forward disinformation and lack of belief in science and evidence. You know, all these numbers are helpful, but we have to address the fundamental drive a lot of this. And it's very purposeful.
Yeah, Alvin, and just to follow what you said, probably at least for us healthcare providers, our job is to fight back the disinformation. Mm-hmm. You know, as an example, and we heard about this mask thing that people were saying that it will kill people. And in the hearing, they were telling the doctor in the panel, we're going to sue you against crimes against humanity and things like that. So immediately we took action and we measured carbon dioxide in us, providers and in patients with COPD with a mask, walking them for an hour, nothing happened, publish it, and it went viral, that masks are safe for people. Simple things that we can do as providers just to change people's mentality, showing them data. No, it's safe, you can do a mask. So we need to fight this disinformation that has been growing and growing as people get more confused and politicians sometimes say one thing or the other and people are in the middle. Who do I believe? We need to make them believe in us again, that scientists and researchers and providers, you know, we are advocating for the best for them without any political inclination. So we need to bring that back.
Yeah, that follows up with a question from the audience about healthcare professionals, because they want to know, how do we approach the need to heal? Because what you're saying about being trusted messengers, one message, bringing the science, is about healing. How are we supposed to heal and recover from this while we're looking forward to the long term, especially with prevention in mind?
So I just wanted to maybe offer one thing, and that is that, you know, we as healthcare providers are, from the very beginning, from pre-medical and onwards, we tend to look at ourselves and our patients, our profession, through what I call a basically pathogenetic mold. That means we always look at what is abnormal and we go to fix it. And we think, rightly so, in terms of restorative health, that when we fix things, voila, health will appear. But it turns out that there's a vast area of knowledge and research that is yet to be explored, which is the opposite, the antonym of pathogenesis, which is salutogenesis. And that is the genesis of health. What does health look like? What contributes to health? And we apply that to ourselves first, and then we apply it to our patients. And really what's beautiful about the concept, and this is how we can reframe things, is that inside all of us, there is an inner doctor. There is a place of healing which can be tapped into that has to do fundamentally with what gives us meaning to life, meaning to our profession. And if we can find that in ourselves and then evocate that to others, our patients, we will help sort of the disease part as well as the health part. And obviously that's something that can be unpacked over the course of many hours of great discussion. But I think that we should shift from pathogenesis to salutogenesis.
I agree. And we're down to 2 minutes. And to salutogenesis and looking at health, we come back to policies. And you can put it in the chat and share it with us later, because policies is about distribution of resources and taking real action to effect a change that then can keep us in that salutogenesis mold. So the audience wants to know, what are we doing locally and nationally, statewide and local for policies that we can be able to achieve this? In a minute.
Thank you, Dr. Holder.
Thank you.
Thank you to all of the doctors on the panel for this incredible presentation. I hope the audience has learned a lot. And so now I would like to take a moment just to remind everyone the importance of education. We are currently fundraising for our Give Miami Day. This is critical work that allows our students and teachers to receive climate literacy, as well as opportunities for climate advocacy. I'd also like you to take a moment to visit our exhibitors section in the Hoover to learn more about the amazing companies that are supporting this event. And now, without further ado, I would like to welcome John Paul Mejia, because our youth have a voice. He is the co-host of our House on Fire podcast, a Gen Cleo advocate and Cleo climate speaker. John Paul, welcome.
Thank you so much, Natalia. I'm happy to be here, to be sharing this space with all of you on such a special occasion. So I am happy to be here, but why are we here? Well, the images of hurricanes and wildfires likely propelled you to care. You may have felt the suffering of communities that have been wiped off maps, or the pain of families whose once cherished homes full of memories are now just piles of ash. You may have swooned into action, understandingly so, by the decades of consensus and advocacy from the world's leading climate experts. You may have joined this event to glimpse into the kind of future that you can leave for your child instead of the one that we seem to be racing towards with no brakes. All valid reasons, resonant with what it means to be human in a time of crisis. We are in an emergency of historic proportions. Our house is on fire and the alarm has been silently going off for years. But have we reached for the fire extinguisher? The truth is, those same feelings that pushed you to get on this call, passion, curiosity, fear, solidarity, whatever they might be, can easily be countered by feelings entrenched in subjects much less humane, like money and expanded profit margins. And those who wield power and influence are susceptible to the charm of these inhumane lures, allowing them to turn their cheeks to our distress. But we know better, all of us here, and we are relentless. For the past couple years, global movements have erupted in the name of climate justice. Begun by indigenous peoples and led by young people today, these movements of millions have pushed over 1,800 governments in 30 countries to declare climate emergencies, despite the apathy of certain leaders. So, what does it necessarily mean to declare a climate emergency, and why is it worthwhile? Well, a declaration of a climate emergency resolution is a piece of legislation passed by a governing body, and it puts the government on record in support of taking emergency action to tackle the climate crisis. And why is it worthwhile? Well, by campaigning for declarations of climate emergencies as a first step, movements have put fire to the feet of leaders who fail to act on the emergency they've legally acknowledged. The Cleo Institute is a proud partner and mobilizer of climate emergency campaigns throughout the state of Florida. Through its Gen Cleo Youth Empowerment Advocacy Group, we have been able to secure 7 climate emergency declarations in Miami-Dade County from the cities of Miami Beach, Miami, Coral Gables, the village of Surfside, the town of Cutler Bay and North Bay Village, and just last week outside of our county as well, the city of Orlando. Last year, I was part of the youth advocacy group that delivered relentless arguments before the mayor and commission of the city of Miami, pressuring them into unanimous agreement to declare a climate emergency. Now, our movement has the ability to hold elected officials accountable on whether they act with enough urgency to tackle this emergency. Case in point, these campaigns work. And we can make undeniable demands to shift the course of action on climate and to pressure our elected officials to act with the boldness and the scope that this crisis requires. But don't forget, these campaigns aren't meant to cater to the people in power. They serve to protect the people and places we love. We know that we can win. But our ability to win is measured by how much people power fuels our campaigns. And that's where we need you. Yeah, you in the tiny squares on my screen. With only a few clicks, you can be a catalyst for change. Sign the Clio Climate Emergency Declaration at the link on the slide. Demand from your cities and elected officials and governing bodies to recognize and confront the climate crisis with bold and equitable solutions to protect the people and places you love, to leave better futures for your children and grandchildren, to make sure that we have livable futures and overall good health. I am deeply grateful to have shared these past couple minutes with you, and I'm more than excited to build solidarity and climate justice with you all, one click, petition, and donation or rally at a time. Thank you very much. I'll pass it back to Natalia.
Thank you so much, John Paul. To be honest with you, when people ask, what keeps you going? Honestly, it's our young people. They do so much for the climate crisis, and it is up to us, the adults in the room, to carry that baton for them and that responsibility. Because the reality is that the climate crisis is a global issue, but you do need local action. So we invite everyone to take a moment today, click on that link and declare a climate emergency. You can, whether you live in Florida, California, New York, the link is actually for the entire United States. So please, together, let's do this. Let's take climate action on a local level. And so now we get to the part of our presentation where for our clinicians, we'll be doing a clinicians breakout session with the University of Miami. You will be receiving a Zoom link on the chat. For everyone else, we will be doing our second movement exercise of the day, followed by our keynote of Mr. John Rulak, executive producer of Kiss the Ground. And then we'll go into our breakout sessions for climate, health, and food. Please remember, tomorrow we are expecting an amazing day, just like the one we had today. Our main keynote tomorrow is world-renowned climate scientist, Dr. Catherine Hayhoe. And our panel will be focused on the health impacts of extreme weather events. So for our clinicians, please make your way to the new Zoom meeting where you will be met with Dr. Kumar, and he will be leading you on that breakout session. So food, it's necessary for our survival. But did you know that the way we grow our food and what we eat actually impacts our global warming? Agriculture is not only one of the biggest sources of greenhouse gases, it's also considered one of the biggest solutions we can use to tackle this climate crisis. From embracing a more plant-rich diet to reducing our food waste, as individuals, we can do a lot. And we're excited to welcome our second keynote for the day, Mr. John Rulak, who is one of the executive producers of the Netflix documentary, Kiss the Ground. Before he gets started, I would like to play a short trailer of the documentary. And Mr. Rulak will be focusing his talk on regenerative agriculture.
There's so much bad news about our planet, it's overwhelming. The truth is, I've given up. This is the story of a simple solution, a way to heal our planet. the solution is right under our feet, and it's as old as dirt.
All of our soils that are under chemical conventional agriculture are almost completely devoid of microorganisms.
Modern agriculture was not designed for the betterment of the soil.
Fossil fuels are by no means the only thing that is causing climate change. When we damage soils, carbon goes back to the atmosphere.
But when we destroy soil, it releases carbon dioxide.
Biosequestration is using plants, trees, and techniques of grazing and farming to capture carbon and store it in the soil.
We can fix a lot of our climate issues if we bring the CO2 down into a living plant.
There's so much bad story of
All of our soils that are under chemical conventional agriculture are almost completely devoid of microorganisms.
Modern agriculture was not designed for the betterment of the soil.
Fossil fuels are by no means the only thing that is causing climate change. When we damage soils, carbon goes back to the atmosphere.
But when we destroy soil, it releases carbon dioxide.
Biosequestration is using plants, trees, and techniques of grazing and farming to capture carbon and store it in the soil.
We can fix a lot of our climate issues if we bring the CO2 down into a living plant and put it back into the soil where it belongs.
Plants working with soil microorganisms, it seems too simple.
Healthy soils lead to a healthy plant, healthy human, healthy climate.
There could be a way to eat food that heals the planet.
The problem isn't the animal. The problem is where the animals are at.
How do we take waste and repurpose and reuse it, because it's really not waste? The poop has to stay in the loop.
Compost is just one of a suite of soil-based carbon capture solutions.
We know how to do it. And if we continue to scale over 30 years, we can reverse global warming.
We can get the Earth back to the Garden of Eden that it once was by regeneration. To see biodiversity return to a place that was completely devastated.
That gives me hope.
Our health and the health of our planet are connected.
If you look over here, my neighbor's land that has been chemical fallow, then you look over at our paddocks, you have a diversity of different plant species. Which model do you want your food to be produced from? The answer is pretty simple to me.
I'll make you a deal. I won't give up, and neither should you.
And so now I would like to welcome Mr. John Rulak, executive producer of Kiss the Ground. Welcome, John. I'm asking you to unmute.
Yeah. Good to be here. Thank you, Natalie and the Clio for inviting me here today. Hope people enjoyed the trailer, and as Natalie mentioned, the Kiss the Ground film, which I'm one of the executive producers of, is available on Netflix, and it's also on Vimeo as well for $1 if you don't have Netflix. So the kind of the journey for me on this film, about 7 years ago, I was in Missouri listening to a talk by a longtime organic farmer named Will Allen from Vermont. And I really had never heard that even though I'd been involved in the organic food business for decades and been going to a lot of permaculture events and knew a lot of people who've been longtime farmers, that really the solution under our feet, soil, can really make a major difference in climate. And it kind of blew me away. And I was thinking, why is it the organic farming movement and climate leaders and environmentalists aren't talking about this? So I set about to learn more about the power of soil and regeneration. And in the process, decide to do a movie to share people this message. And it's a hopeful message that nature is very resilient, and we just need to work with nature. So I encourage people to watch the film. I'm gonna open up a slideshow here. Let's see, I'm hoping people can see that now here. So this concept of regeneration, maybe, Natalie, can you just confirm people can see the slides?
Yes, we're seeing it. Thank you.
Okay, great. Good. The concept of regeneration is not a new concept. Indigenous cultures for tens of thousands of years have practiced regeneration, and it's essentially working with nature and instead of working against nature. Imagine if the new Biden administration would, the energy czar that they're bringing, or the Secretary of Agriculture, would place regeneration and regenerative agriculture as part of a suite of tools to address climate change. What the benefits would be, not only for our country, for the planet. And we're really facing a crisis today. I was talking with someone from Germany that's involved in the regenerative agriculture movement. He was saying that up to 100,000 acres of farmland every day is lost from urbanization, to erosion. The soil is so precious, and it's what gives us food, gives us nourishment. One of the things that I found fascinating is just the lack of awareness around this concept of regeneration and biosequestration of carbon through the living soil and living systems. And there's several reasons for that, and we're going to talk about some of the solutions, but let's talk a little about what are some of the challenges. And I look at it for several reasons. But first, this was a quote from over 3,200 years ago. "Upon this handful of soil, our survival depends. Husband it, and it will grow our food, our fuel, our shelter, and surround us with beauty. Abuse it, and it will collapse and die, taking humanity with it." Pretty sage advice from 3,200 years ago. And today, all that legacy load of carbon that's been released for thousands of years and is especially accelerated in the last 150 years with industrial agriculture and burning of coal and fossil fuels, has really given us an opportunity to heed the wisdom of this gentleman from back 3,200 years ago. And so what are some of the challenges? To me, one major one is economics and the corruption of our system. Here's a quote from Thomas Jefferson. If you think about it, so much of the economic power has been concentrated, and this has really influenced. For instance, why isn't major universities such as Iowa State or Cornell, et cetera, land grant universities more focused on regenerative agriculture? Part of it is that in the 1970s, a lot of the research was done by public institutions. Today, the majority of research is funded by the very agricultural chemical companies that are part of the problem: the Monsantos, the Bayers, the Dows, the DuPonts. So, we see this in how what happens in policies in our cities and our capitals, state capitals, and also at the federal level. So addressing the issue around money and its power is very important. As an environmentalist for 35 years, I've seen we have a lot of good solutions. The challenge sometimes is the money corrupts a policy, and it's not an easy thing to solve. But if we're gonna change the food system, we're gonna change the energy system, we need to address this. The other issue outside of money is really our connection with nature. And here's this, I remember coming across this this lovely painting and showing a young woman really, connected with nature, enjoying the beauty of nature in that flow. And when we learn to spend time in nature, and if you love something, you're going to take care of it. And if you learn to love nature and enjoy, the beautiful creatures in the sea and the butterflies and all the symmetry of nature, we're going to take care of it more. Sadly, our institutions, from religious to economic and government, over the years has really helped people to be disconnected to nature and cut that link. So really important to learn to spend more time in nature. And if we can honor nature more, we can also learn to help nature and serve nature better, this ecological system. We don't have a plan B on this planet if we destroy the very basis for life. So I encourage people to do that. And when you look at this modern movement of the environment to take care of the planet, a big piece as solar energy. I remember hearing Ralph Nader talk about the power of sun and the solar energy, 20 years ago. And we've made a lot of progress in producing energy from solar and wind, and that's been very good. And we continue to make more progress. Also knowing it does take resources, mining and other things to make these renewable energy, but it's still better than burning coal and burning oil and fracking. And we've made a lot of progress. The part of the challenge is, though, that what I call the modern environmental movement, and I kind of going back to some of my pathway and interest in the environment. When I was 21 years old, they dumped an unidentified truck driver dumped nuclear waste 9 miles from my home, and that really set me off to like, why? How could that happen? And that was about 40 years ago. And I've been involved in various environmental campaigns to protecting forests, to composting, organic foods, non-GMO, hemp movement. And we've made a lot of progress, and it was exciting. Speaking about progress, it was exciting to see John Paul and the youth panel. Really, our generation as a boomer, we've left a big mess, and really the opportunity is for us to do the best that we can where we have now, but it's the next generation that really can step up and make the changes. And for example, the Sunshine Movement is a youth-led organization and millennials to change the energy system, and they're also now starting to focus on food. But the vast majority of our effort in the climate movement has been focused around clean energy, and that's important. We need to decarbonize our energy system, but more importantly as well, most importantly, is we also need to recarbonize our soil. We need to take that legacy load of carbon that is accumulated into the atmosphere for eons that is causing issues, as we know. And as we're seeing more intense storms here in the West Coast, a year ago, we had a little over 1 million acres of forest burn. This year was 4 million acres, including right where I live in Sonoma County. So we have to deal with this legacy load, and agriculture can do that. But the interesting thing is the main message of some of the environmental leaders has been oil and coal is bad. Solar, wind, and Tesla is good, full stop. That will solve the climate crisis. And we know that's part of the solution. But the other part of the solution is regeneration and protecting nature. And so I really look at the climate movement. I'm a bit of a critic of some of the climate movement, because this communication plan I think really deserves an F. Sorry to be so blunt, But if you just continuously tell the general public that all we need to do is go to green energy, we're going to see the challenges, and it's not going to be the full solution. We need to do a combination of things, and regeneration. And that part's not only is in agriculture, but also protecting our forests and protecting the Amazon and doing things. So we need to move beyond and encourage people to be part of the solution. One of the things really is our whole industrial model. We're really causing a lot of damage to the planet, and we really need to address this. And it's not an easy thing, and it can seem overwhelming at times. I know as an environmentalist for the last almost 40 years, it has been sometimes I've felt very challenged to see, what can we do? But individually, people can make change. Just look at some of the movements. Look at gay rights. 25 years ago, if you ask people where you thought that might be politically, they say, well, it's a really important issue, but I don't think we can win. And now there's been major changes there. So social movements can gain power, and it's really up to all of us to make those changes. For those who are interested in some of the solutions in this regeneration, there's a great book called Drawdown, the most comprehensive plan ever proposed to reverse global warming, edited by Paul Hawken. Paul's a friend of mine. He's a founder, one of the co-founders of Project Drawdown. And in this book is 100 solutions that scientists from around the world. And it was interesting, Paul wrote this book. Initially, he went around and talked to every major environmental organization, and he asked, what's your plan for climate change? And he was astounded. Paul's based in California, and he's written several books, including The Ecology of Commerce, which I would encourage people to read. And he was astounded that most every major environmental organization, even though they admitted that climate change was the most important issue on the planet for the environment, that they didn't really have a plan. So this book really lays that out. Excellent book. The concept, we'll talk a little about this regenerative and the journey. Today, much of the way we grow our food is degenerative, using excess pesticides, chemical fertilizers, all the dead zones. For those of you in Florida, you've seen all the runoff from industrial agriculture, killing some of the manatee, making the waterways void of life. So this degenerative system we really need to change that. Back in the 1980s, people said, well, maybe we could make it sustainable. So imagine taking a degenerative system and saying, we're just not going to make it worse. And so sustainable energy, sustainable agriculture became an important movement in the 80s and 90s. And then recently, it's become more popular, this concept of regeneration, that not only we don't want to just sustain it. We need to go back and regenerate. If we've lost 50% of our topsoil, and if we've degraded ecosystems, do we want to just sustain it at a very low level, or do we want to regenerate? And we can actually, which shows in the Kiss the Ground film, we can actually rebuild our soils. We can reforest. We can plant mangroves and help sequester vast amounts of carbon. So regeneration is the next level above sustainable, and encourage people to learn more about that and participate in that. One way to think about the difference between regenerative and degenerative, in a regenerative system, think of it as running on today's sunlight. The sun is such a powerful natural force on our planet. And living systems are powered by sunlight and water. So regenerative farmers work with plants, living systems, to create fertility and produce the food. And also the main source that runs regenerative systems not only as sunlight and water, but as carbon. So they take the carbon that's in the atmosphere and sequester that to in through the living root and trees and limbs of plants. So it's a very natural system. It takes a little more time to do it, but it's happening. I'll give you an example. There's a farmer in Indiana named Rick Clark. He has 7,000 acres, and he was using, 15 years ago, was using the pesticides, herbicides, exactly what, Monsanto and Bayer, and probably what, when he went to college and agricultural school, he learned to do. And he started to learn about working with natural systems, running on solar energy from the sun, not from petrochemicals. And today he's growing 7,000 acres of corn and soy regeneratively, no-till, and also organically. So it can be done at a large scale. On the other hand, degenerative agriculture such as Monsanto, it's powered by petrochemicals, yesterday's sunlight. So we're using not only petrochemicals to make pesticides and herbicides, but chemical fertilizers are made from fracked natural gas, and they emit something called nitric oxide, which is over 380 times more powerful than carbon. So it's a real issue. And this degenerative agricultural system has impacts more than people can imagine. Here's a beautiful picture of a lovely moth. And how many people realize that over 75% of all winged insects, bumblebees to moths or bees, have disappeared since the 1970s. And we know this partly because of some research of some German citizen scientists who have been testing and capturing insects in fields, in forests and meadows in Germany since the 1970s. And now this experiment is being done around the world. And they're saying that the two main reasons for this loss of insects is pesticides and chemical agriculture, which actually it's designed to kill pests. That's why they call it pesticides, and loss of habitat. And what likes to eat insects? Birds. So as we destroy our insects, we destroy the birds. So agriculture is today, the way we're practicing is literally destroying the fabric of life. And it's also not only impacting people, ecosystems, but it's also hitting people here. Since the introduction of GMOs in the United States in the 1990s, which included the use of Roundup and herbicides, the more GMOs we've introduced for corn and soy, the amount of applications is very intense, which we go into in the film of Kiss the Ground, if you want to learn more on that. One of the things we've noticed since the 1990s is gluten intolerance. People didn't have gluten issues in the 70s or 80s. Also, peanut allergies. When I grew up, you could bring a peanut butter and jelly sandwich to your school, but now it's illegal to do that. Also, autism. Today, 1 in 52 young boys are born autistic. In the 1960s and 70s, when I grew up at school, it was 1 in 10,000. And it's hard to say exactly what is the smoking gun, but we do know that we've seen this surge of environmental illnesses in the last 30 years. Cancer has also increased. Infertility. There's a fertility clinics on in many urban areas today, whereas in the 1960s or 70s, you really didn't have to worry about that. We have much more autoimmune diseases. We have leaky gut and digestive issues. And for people who are in their 20s and 30s, that never used to be the case. There was a researcher at UC Davis, and she's been doing some research on this, but she hasn't been able to get funding. to do more. And again, because of the corruption, we really need to know on this. Why isn't the medical deans and leading researchers at Harvard and Yale looking at this issue? This is a national crisis that we're facing in health, and it's tied to environmental factors, and we need to find out more about that. Now, I want to talk about an issue that's rather controversial, and that's about the cow. To many people, cows are the problem, but especially in the modern environmental movement. But more and more people someone came up with a term recently. It's the how, not the cow. And when you force all the cows in pens, it causes major issues. A lot of concentration. The cows are unhealthy. But when cows are grazed using grass and they're never sent to a confined animal feedlot, it's a whole different situation. And there's more and more evidence showing that by doing this moving them by mimicking nature, similar to what the buffaloes were, that there's significant carbon climate benefits. And our film goes into that, and it's something to learn more. Also, I want to mention the Lakota Rosebud Reservation recently established a 28,000 acre buffalo ranch, and buffalo are being reintroduced, and that's really great to see the Plains Indians come back. At one time, there was over, I think it's 100 million or more buffalo, and those were exterminated in a genocide against indigenous people. And now they're bringing back the buffalo, and that's a great thing. And it definitely can be involved in helping as part of the solution, regenerative ag. Also, another, many of you may understand what this tree is. This is a mangrove tree, and mangroves play an important role, especially in Florida and in the tropical areas. Mangroves, people may not be aware, sequester 4 times the amount of carbon than what sequesters in an Amazon forest or a temperate forest. So they play an important role in moderating tide surges, and it's really important for us to restore mangroves, and a lot of it's been removed, especially in Florida, especially in many parts of the world. So I'm involved in supporting mangrove projects restoration right now in India and also in Guatemala. One thing I wanted to mention is I want to call out a special project that I learned about a year ago, and it's called Contour Lines Corp. And it's a young gentleman that was traveling around interested in organic farming, and he's taking degraded land where Mayans in Guatemala were growing corn and slash and burn, and reforesting it with bringing in nitrogen fixing trees, and then planting like mangoes and avocados, and they're getting very good results, and the villagers are very pleased with it. It's stabilizing the soils and providing income. So agroforestry is something really worth checking out, and we can grow, sequester a lot of carbon and grow a lot of food through agroforestry. Now I want to shift a little about the oceans, one of my favorite things. And this is obviously a sad photo. This is a baby seal that's been starving. We've seen a lot of this in the West Coast, and we face a real crisis in the oceans today. And it's not the easiest thing to talk about, because we don't live on a land planet. We live on an ocean planet. 70% of the planet is ocean, and we really need to learn to take care of the ocean. It provides over 50% of the oxygen that we breathe, and how we grow our food systems, how we grow food, and its impacts not only from chemical runoff, which you see in the Gulf of Mexico. There's over a 500 square mile area that's biologically devoid from all the chemical fertilizers from the corn and soy and other agricultural crops. So we need to shift that. one of the indications of the problem we're facing in the ocean is the Pacific sardines. So, and what do sardines eat? They eat plankton, and plankton are slowly dying in the oceans because of excess carbon. Here you can see from 2007 to 2015, a 90, almost a 90% reduction. And it's gotten even worse in the last 3-4 years since 2015. So I think we're down over 95% of the sardine population, and in the Pacific Ocean, either most of the sea life either eats sardines or eats what sardines eat. So it's a keystone species, and we really need to take care of it. And a big issue is all that legacy load of carbon. So sardines play an important role. And just to recap some of the challenges we're facing, the oceans, the oceans are getting hotter. They're getting more acidic because of the legacy load of carbon. It falls into the ocean, creating more acidic conditions. Plankton can't live in this acidic condition. The good news is, though, we have the opportunity to take that excess carbon that's impacting our oceans, and through living systems on the land, and sequester that carbon through restoring our mangroves, through agroforestry, through regenerating grasslands, through planned grazing such as buffaloes and cows done in a regenerative manner. Because if we don't, we're going to have less plankton, and that means less oxygen. And what that means is we're looking at our current rate, we're looking potentially for the death of 100% of all of our whales, dolphins, and fish by 2040. Here's the right whales are suffering significantly. And some things we can do at our home. We can cut out that organic matter, and never buy degenerative industrial meat. If you are going to eat meat, make sure it's regenerative, pasture-based. Buy as much organic food as you can, and teach out. Septic regeneration is very simple. It's basically taking that carbon in the atmosphere through a living system and bringing it back into the soil and releasing oxygen for the environment. And then to close here, this beautiful sea creature that enjoys the living in the great oceans, the survival and future of these species is dependent upon us and what we do in the coming generations. So I encourage everyone to respect nature and learn that nature can be our ally, and we can regenerate planet Earth and help and go from global warming to a global cooling. It's going to take a lot of effort. The challenge is significant, but it's our best pathway for survival. Thank you for your time today, and I appreciate the opportunity to talk about regenerative agriculture. I encourage you to watch the film, Kiss the Ground.
Thank you so much, John. We do have one question that we will open you up to from our youth programs, our Gen Cleo Clip Kids. They want to know, what is your opinion about substitute meats? This question is coming from Miami Northwestern Senior High School.
I like to say we need 1,000 flowers blooming. The challenge with a substitute meat, such as the Impossible Burger, is it's made from genetically modified soy grown with toxic herbicides such as Monsanto Roundup and dipped in a bath of hexane industrial solvents. So, but if people can create meat, substitute meats that is grown in a regenerative manner, that's much better. I know they're talking about lab grown meat, but it's a much longer discussion, but and I encourage people to investigate that, but it's much more regenerative to eat 100% grass-fed through holistic grazing than it is an industrial plant-based burger. But a plant-based burger is better than the worst meat. So we need to do both. We need or regenerative vegetarian food, and we need regenerative, omnivore diets as well. So it's complex, as they say.
Understood. Well, thank you so much, John, for your time. We at the Clio Institute are very excited to have you on board for this presentation. For those of you that would like to learn more, we do host a class over the summer on climate and food in partnership with the University of Central Florida and University of South Florida. So if you follow us on our social media or sign up to our newsletter, you can get more information once that class opens next year. And now, as part of our call to action, we would like everyone to exercise their civic engagement. We would like you to tweet to our President-elect, Joe Biden, and our Vice President-elect, Kamala Harris, and make sure that their choice for the Secretary of the USDA Department understands regenerative agriculture. And please don't forget to use the hashtag ECCC2020. We are dropping the language you can use for your Twitter or Facebook on the chat. So we encourage you to voice your opinion, and let's make sure that our next Secretary of USDA understands the importance of regenerative agriculture. And so now we come to that part of our event where we will be splitting you up into 3 breakout sessions. You have the opportunity to choose one of the links below. You can join Mr. Luis Nieves for food systems, Mr. Sam Grant to learn more about urban farming, or Dr. Brooke Hansen to learn about agriculture and climate change pathways to resilience. So please take a moment to choose which one of the 3 breakouts you would like to use. And that will conclude our day on the main Zoom link with me. I look forward to seeing everybody tomorrow for Dr. Catherine Hayhoe, and I hope you enjoy your breakout session with one of our 3 panelists. John, thank you for today. Have a wonderful rest of your day.
Thank you. Let's regenerate.
Let's regenerate.